Hello, and welcome to Next Generation Behavioral Health.
10-minute tips for modernizing patient care.
I'm Dr. Christine Armstrong.
And I'm Dr. Julie Kin. Christy and I are psychologists working in the Defense Health Agency of the U.S. Department of Defense. Our team develops health technology to help support service members, veterans, and their families, and their military healthcare teams.
And we also train clinicians on how to use technology in clinical care. In this podcast, we'll share answers to the most common questions we hear.
And we'll do it in 10 minutes or you get your money back. Today we're going to be talking about what to expect from this series and why we're so interested in mobile health technology. I think to help answer that question, we should probably share a little bit about our backgrounds because we've been working together in the DoD since, 2010?
That's right, 2010. We both started working together.
We both started primarily as researchers on a project including technology to look at reducing suicide outcomes and self-harm. But since then, we've both been in lots of health technology projects, and your big role has been leading education and training for providers.
For the last 3 years, I've worked as the Education and Training Program Lead at the National Center for Telehealth and Technology. And we have been traveling across the country, training military providers and some VA providers on how to safely and ethically use technology in their clinical practice.
Yep, and I'm one of your trainers, so I get to work with you on that. I'm also the deputy director for our mobile health program, so I get to oversee the teams that make our mobile apps, websites, and other health technology for behavioral health, mental illness, and general quality of life. So I guess that's enough about us, unless there's anything else you wanted to add.
No, I think that's it. All right, so Julie, let's talk about why mobile health is so important.
Well, when we first started doing these trainings many years ago, we'd have folks come up to us and ask, how do I download an app? Or what's the difference between an app and a website? We don't get so many of those questions anymore. Our providers are getting a lot more tech savvy, but they're still not using health technology with their patients as much as they probably could, considering that our beneficiaries are using it all the time.
That's right. All the patients that we typically see in the military, a lot of them are very young. About 2/3 of service members are age 30 and below. So although they're this group of very young, vibrant people that are usually pretty comfortable using technology in every aspect of their lives, providers are generally 30 and above. For all of us folks that are 30 and above, smartphones and mobile apps and things did not exist when we were growing up and definitely didn't exist when we went through training. So understandably, a lot of providers are hesitant. How do I integrate this into care? However, they also have the conflict that they see their patients coming in saying, hey, I'm using this app to track my sleep or my activity. And frankly, a lot of times providers have had the unfortunate situation that then they kind of disregard the data because they're not sure what to do with it.
These days, I do believe a lot of providers use health technology for themselves, like recording calories, their steps, fitness schedules, medication compliance. And they know their patients are using it too. They just want to know how to leverage that technology in an effective and evidence-based way.
That's right. And a lot of research has been coming out showing the benefits of mobile health in clinical care. We've seen data showing that patients are more compliant with homework when they integrate a really high quality app into their treatment. Also, it's more efficient. The way we conduct our care is more efficient. If we're not looking at a piece of paper, we're instead able to see how the data was tracked conveniently over time.
Right. A lot of what we're going to be talking about in this series is practical tips like how to tell which apps are good apps, which ones are safe to use and effective and evidence-based, how to dip your toe into the water and meet your patients halfway. We know that if patients are showing that engagement, if they're bringing you an app to look at, we want to encourage that. Of course, we'll repeat this message too, that we don't want to force people into using health technology if they're not comfortable with it. And of course, we'll have episodes all about the ethics and cultural considerations.
Definitely.
Like you said, keep in mind that our beneficiaries are using mobile devices in all facets of their lives. Most providers these days, and definitely most of our service members, are sleeping next to their smartphones. They're using them as alarm clocks. And so that means that the first thing we see when we wake up in the morning and the last thing we see when we go to bed at night is our smartphone or a mobile device. Just think of the potential for leveraging that technology that's already pretty much attached to us to help with behavioral health care. We'll also bring in some interesting guests to talk about modern innovation and health technology so you can be on the cutting edge. Our bottom line is going to be get out there, kick the tires, learn about the technology because your patients are already using it, and we want you to be familiar with it so that you can help them use it safely and effectively. So, Christy, what are some of the other main points you'd like to get across to our listeners?
Integrating technology into care doesn't change the way you're practicing. When we're trained on how to provide evidence-based treatments, we are not veering from that at all just because a new technology came in. The most important part of this new addition of a mobile app is that you're taking that evidence-based treatment and now you're doing it in a more efficient way. And you're also able to collect data that's actually accurate. So, Julie, I've got a question for you.
Okay.
Say in the past, before mobile apps in care came about, how would you have your patients track their moods in between their sessions?
A sheet of paper. I would have printed out a sheet of paper from the computer, and they would fold it up and stick it in their pocket or their purse or their wallet.
Mm-hmm.
And then most times I would either never see it again or I would come across them filling it out in the waiting room. It didn't have that environmental, what's the word?
Ecological validity, right?
Thank you.
Absolutely. That's the fancy science term, everybody, for the data isn't accurate at all because it wasn't being taken at the point the person was experiencing it. So you're right. That's all the military providers that we see, all the providers we work with have that same response. They laugh when we talk about that because it's so true. If your patient happens to be compliant with the homework, most likely what will happen is they'll busily fill out a whole thought record or all their moods or all their sleep information right there in the waiting room right before you see them.
It's also stigma inducing. We know that our military patients, and for many civilians as well, perceive a stigma against receiving treatment for behavioral health, right? So when you ask them to fill out a big sheet of paper, that can be stressful and increase some of those stigma-inducing thoughts. Whereas if it looks like they're just playing a game on their phone, sliding little red dots up and back, like is the case with the T2 mood tracker, then it reduces some of that barrier to care.
Right. It's going to increase their privacy of their data instead of having this piece of paper flopping around.
Yes, exactly. We'll get into many more practical tips, 10-minute tips, throughout this series.
Providers have been hesitant to adopt this technology in clinical care. And so that's why we wanted to create this podcast to share with providers how to introduce an app, how to choose an app, how to prescribe an app, and also give you some insight from some of the leading experts in military mobile health.
Thank you so much for joining us today on our first episode of Next Generation Behavioral Health. Let us know what new health technologies are exciting to you.
And stay tuned for future episodes about protecting patient information, how to prescribe apps, the latest mobile health research, and also interviews with experts.
Next Generation Behavioral Health is produced by the Defense Health Agency. Reach out to us on Facebook and Twitter at Military Health, and subscribe and rate our show on iTunes or wherever you get your podcasts.